Will Medicaid pay for my Medicare Part B premium? What you need to know about Medicare Part B premiums. Medicare Part B premiums are a crucial aspect of managing healthcare costs in retirement. Knowing who is responsible for paying these premiums helps you plan and budget effectively. This guide explores the essentials of Medicare Part B premiums, including who is liable for paying them, how Medicaid may contribute, and any exceptions that may apply. The basics of Medicare Part B premiums. Medicare Part B is a government insurance plan that helps cover medical expenses such as doctor visits, hospital stays, lab tests, and certain medical equipment. To enroll in Medicare Part B, you must pay a monthly premium. The premium amount can vary based on your income, and if your annual income exceeds a certain threshold, you may have to pay an income-related monthly adjustment amount, increasing your total premium cost. Typically, individuals are responsible for paying their own Medicare Part B premiums. However, there are circumstances where other sources of payment may be available, such as Medicaid, family members, private charities, or county programs. Who is responsible for paying Medicare Part B premiums? Individuals. Individuals are generally responsible for paying their own Medicare Part B premiums. This means that if you are enrolled in Medicare Part B, you will be expected to pay the associated premiums. Insurance providers. In some cases, an insurance provider may be liable for paying Medicare Part B premiums. For instance, if you have a supplement provider, such as a Medigap policyholder, the policy provider may cover the cost of the premiums. Additionally, employer-sponsored group health plans may also be responsible for paying Medicare Part B premiums. Check with your provider or employer to see if your insurance policies cover Medicare Part B premiums. Medicaid. Medicaid, a government program providing healthcare coverage for people with limited income and resources, may also be responsible for paying Medicare Part B premiums in certain circumstances. Eligibility requirements for this coverage vary from state to state, so it's best to contact your local Medicaid office for more information. Can Medicaid help with Medicare Part B premiums? In some cases, Medicaid might assist with the cost of Medicare Part B premiums. Depending on your state, Medicaid may offer assistance to those meeting specific eligibility criteria. For example, programs like Enhanced Primary Care, EPC, or Medicaid spend-downs in some states allow individuals with lower incomes to get help paying for their Medicare Part B premiums. Additionally, some states may waive the Part B premium for certain elderly and disabled individuals. Medicare Savings Programs, MSPs, are federal and state programs that can help pay Medicare Part B premiums as well as other healthcare costs. To be eligible for an MSP, you must be enrolled in Medicare Part A and meet certain income and resource limits. Exceptions to Medicare Part B premiums. In certain situations, Medicaid may pay for your Medicare Part B premium. These exceptions typically occur under specific circumstances or life events. Some situations where Medicaid may cover your Medicare Part B premiums include if you have a disability or recently became disabled, if you receive Supplemental Security Income, SSI, if you are an enrolled member of a federally recognized tribe, if you are eligible for the Qualified Medicare Beneficiary, QMB program, if you qualify for extra help with prescription drug costs. Each state has different eligibility criteria for this service, so check with your local Medicaid office for specific details. Frequently asked questions about Medicare Part B premiums. How often do I need to pay my Medicare Part B premium? Medicare Part B premiums are typically billed monthly and are usually deducted directly from your Social Security benefits. What do I do if I cannot afford to pay my Medicare Part B premium? If you have difficulty paying your Medicare Part B premiums, several options are available. Contact your local Medicaid office for assistance, as they may provide financial help or connect you with other services. You may also be eligible for a Medicare Savings Program, which can help pay for certain Medicare-related costs, or the Extra Help Program, which helps low-income individuals cover prescription drug costs. Will Medicaid pay for my Medicare Part B premium? Medicaid may contribute to your Medicare Part B premium depending on your circumstances and eligibility. Speak to a qualified Medicaid representative to understand your specific situation better. Are there any exceptions to who is responsible for paying Medicare Part B premiums? Yes, certain life events may affect who is responsible for paying Medicare Part B premiums. For example, If you're receiving disability benefits, you may be eligible for premium-free Part A. Additionally, some individuals may qualify for assistance from special programs designed to help those with limited incomes pay their Medicare premiums. Conclusion: Medicare Part B premiums can be a significant expense for individuals enrolled in Medicare. Generally, individuals must pay their own Part B premiums, but there may be exceptions depending on your state and individual circumstances. Medicaid can sometimes help cover these costs, so it's important to explore all your options and speak with your state Medicaid office to see if any available programs suit your needs. For more information on Medicare Part B premiums and who pays for them, contact your local Medicaid office or visit the official Medicare website. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.